The SIU School of Medicine has had from its very beginning a foundation of social accountability and a commitment to it. And we've lived that commitment for over 50 years now. It's actually in our mission statement. Our mission statement is to optimize the health of the people and communities of Central and Southern Illinois through the things that we do, education, research, patient care, and service to the community. So it's been part of what we do down through the ages, and it's evolved, and the pandemic has allowed it to come to the fore, and I think we really succeeded during the pandemic because we had this solid foundation. For example, several years ago, we started a hotspotting program, and then we had an Enos Park community collaborative that we did. We got faculty members, students involved, and we realized very quickly that we needed community health workers to really have that link from the community into the practice and to result in better health.
When you go and really understand the dynamics of a community, they're complicated, they're challenging, and often, to better understand the community, the easiest place to start is ask the community. For us to achieve our mission of better understanding and advancing the health development and wellness of residents in SIU School of Medicine 66 County Service Region, we knew that we had to develop a department that worked on better understanding the region, understand their diseases that affected them, to design programs and policies that really thought through their culture, their political, social, and legal surroundings. And then in order to take that understanding, use that to build those programs and policies, we also had to sustain them by working through a political environment so we could transform public policy.
During the pandemic, it became obvious that we needed people in the community understanding what the needs of the community were for testing, contact tracing, for basic needs, and then for vaccination after that. So we were quickly able to develop our pandemic health worker program that spread through many counties through Central and Southern Illinois, and actually to the north of us as well. The pandemic health workers did come from the community. They had been the community health workers, so they understood the issues related to building trust and getting people together to solve problems and to get everything that was needed there so that people could deal with the pandemic and actually improve their lives during the pandemic.
This office has been around for several years now as an extension of the SIU greater mission, and so our goal is to make people more self-sufficient, whether that's through connecting people with resources, connecting people to education, getting them the things that they need to live a more self-sufficient life. We have to listen, and that's what's really important, is that we have people on the ground who know what's going on in the community and we can respond appropriately.
The COVID-19 testing center was different because our center didn't require you to have any symptoms, didn't require you to make an appointment. It was community-wide, it was open. Other places, you had to book an appointment, you had to have a symptom. That wasn't us, because we're exemplifying what community means.
Access for all. In our area, there was no testing for children, so we wanted to help solve that problem. In the Metro East area, the greater St. Louis area, we actually established a mobile van. We also did that in Quincy that went to the places of highest need so that it was a very easy type of access for the people in a variety of settings.
If you need a test, if you are nervous, if you're scared, come to us, everyone. Everyone. The real intention was, we are here for the community.
Having a partnership with an educational institution such as ours was a big win for the health department as well. There was no statistician in the health department, so Dean Cruz recommended a statistician. We were able to get them to help out, and all this was done on a voluntary basis. We were hotspotting, so how are you going to interpret that data? How are you going to utilize it? And how are you going to verify the accuracy of this? So all those things were being done, and we used our learners in infectious diseases to help out in the hospital system. Medical students were being involved, makeshift hospitals hospitals in case we have huge numbers of patients that we need to take care of. And then training, if they're residents or students which may have to run the ICU, run the show there in the ICU, how do you exactly train them? We had to give guidelines to businesses, we had to give guidelines to the schools, and really trying to be as focused as possible on evidence-based information and prepare the nursing homes in terms of PPE, the isolation protocols. If there was any shortage, the health department was helping with that and guide them through the process as best as we could.
SIU Centers for Family Medicine operates one of the largest university-owned, federally qualified health centers in the country. And it was family medicine that was one of the first departments that stepped up in the pandemic. This is what they do every day. This is why they're established. They're there to serve the community, and we're really proud of that work. And it's just another example of how we're already built with an infrastructure to serve our community. But in the time of the pandemic, certain departments like family medicine were ready to really lead the charge.
One of the really important things during the pandemic was our work with telemedicine. At the height of the pandemic, more than 50% of our visits were telemedicine visits. Again, it allowed us to maintain continuity, and now, as we've come out of the pandemic and we're back to full speed, face-to-face with our patients, still 12 to 20% of our visits are telemedicine visits, and for some departments it's even more than 20%. So we did use our basic premise of innovation and creativity to get there very quickly, to expand it, and to get it to all of the people who needed it.
One of the things I remember is the weight that we all felt in being public health communicators in a crisis. And it's a really good example of how our social mission of accountability to our communities and a defined population is not just something that's focused on our clinical teams or even some of our educational teams. It also extends to our professional teams like marketing. So the pandemic was one opportunity we had to figure out a way to, as a medical school, provide healthcare education, not just to our students, not just to our staff, but to the community. Early on in the pandemic, we identified ways to work with our hospital partners, to work with the other clinics, even our competitors. We are built based on collaboration. We're community-based. And so we were already positioned to do this work well, and it's going to extend well into the future. It's what we do, and it's what allowed us to succeed during the pandemic.
For the past few years, we've been putting a greater and greater emphasis on equity. We strive to be a just, fair, unbiased, and anti-racist organization. So we have developed an anti-racism task force, and through the Office of Equity, Diversity, and Inclusion, we developed a program during the pandemic that was the Equity Response Team. The Equity Response Team focused more on the issues of justice and fairness, and we realized that many programs could be developed, but without changing our own culture, we really couldn't help those in need in the community.
SIU and the leadership here is very committed to getting it right. Once I started looking for jobs, I knew that I wanted to go to an academic place where I could pursue research, train the next generation of physicians to be patient-centered, as well as to be in a place that really engages the community and has a real social justice mission, where the conversations that members in the institutes were having were more advanced than what should we be doing, but more of looking at how are we engaging, are we empowering and affirming and building and uplifting the community with the resources that the institution provides and makes available for the community. Talking and hearing about Dean Cruz stating that he wanted the institute to become an anti-racist institution prior to George Floyd's murder. And at that time, I had never heard of a dean level position making those sort of statements in a very proactive manner. And so that was very attractive to having a different culture in a way that sort of aligns with my ideal vision of how institutions can be engaging the community, aware and commenting on the realities of the experiences of those members in the community.
We're really only as good as our weakest point, and so we want to make sure that when we can improve the health of those who are, especially who are underserved and underrepresented, that raises the entire community, and that's part of the mission of SIU.